What's today?
Surgery.
What day is it?
November 2nd, 2012.
How are you feeling?
I'm sick.
Yeah.
Brody's crying.
Are you scared?
Yeah. I already took my anti-nausea pill, and I can't wear any lotion, deodorant, anything. So I'm a dry raisin because I also had to shower. And I had to use soap on my whole body. And I'm sick.
Are you ready?
No.
You're not excited?
I'm excited for a week from today. When I feel better and my drains are out and I'm not puking and I'm not having IVs in my arms.
Okay, are you ready? It's time to go.
Yeah, let's get out of here.
Yeah, cute in your little scrubbies. How's it going, dude? Doing good? Because you're relaxed? Like, when you're nervous, you usually relax. Bye, baby.
Bye.
Love you.
Just push the button.
Yep. I don't think you should get up, baby. I know. But there's no food here.
I know, but the sooner I get up, the sooner I can go get food.
No. Just let your body do what it needs to do. What is it? Where are you going to? Food's at home, love.
Hurry.
I know. Is it weird that you look really
Do you
handsome?
have anything in the car, like a protein bar? I'm so hungry.
We live like 2 minutes away.
I know, but I'm hungry.
I'm so sorry I didn't bring you anything. Okay. It's gonna look bad, baby. You have to be okay. It's gonna look bad. You did it 2 days ago.
Okay. Take your time.
Well, let's do.
That's a good idea.
Oh, here, I'll clip it to your pants for now so you can just see everything. Starts over here.
Where did my dreams come from?
Here.
Can I do this?
You want to do that one?
No.
The drains are going in your armpit. And remember, he said you might be able to see it through your skin, okay? Don't look at your skin. You're gonna fall down? Okay, just take a deep breath, okay?
Okay.
Doing good, hold on.
How bad does it look, babe?
I can't see much yet, hold on. Just try to concentrate.
Okay.
Okay. It's okay.
Don't leave this part on. That's not what I'm supposed to do.
Oh no, I think we take these off. Are you ready? It's gonna look pretty messed up.
I just sit down. Is it okay?
Of course it is.
Oh.
Here?
Yeah, just nice. Okay. Alright,
That's cool.
This is really easy. This is just so easy.
Good job, love.
Not so bad,
Good,
right?
huh?
Thank you. Oh, it's out.
So much better. And then let's just see here.
That's so uncomfortable.
What's that?
It's so uncomfortable.
The drain is?
Yeah, like when you
Yeah,
push.
they're not meant to be. How long has it been bright red? Since the start? Yeah, it must have stirred up a little bleeding or something.
Mm-hmm. It started bleeding right where you are this morning. A little bit the nights before, but just a little bit during the night.
Yeah. Okay, just a little gentle.
Oh.
That's it.
All
Alright. Alright, just
Good
relax.
job.
Don't move your arms around too much. Okay. So,
So Taylor here. I am 1 week post-op. So if you've been watching the whole, first section of this video, you've kind of got to see a timeline of how it's been going and sort of my whole journey through the entire thing. Sorry you've had to deal with me and my dorky glasses. I just have not wanted to put my contacts in, so it'll probably be the only video you guys see me in my glasses. But so this is what I look like now. I'll try to get close to the camera. The stitches are still in, so if you see the little white stuff hanging out, that's what it is. I personally am really happy. I mean, it of course looks pretty deflated, but that's because I don't have any muscles built up yet, That is a normal thing. I'm really excited, but so I'm here to just kind of talk about what the first week was like, where I am now, everything like that. So to start off, like the beginning, I was really nervous for surgery. I was really nervous for the IV going in my arm because I don't do well with needles and that kind of thing. But as you saw in the video, they gave me it was actually a Xanax right when I got there, and by the time I was ready to get the IV in my arm, I did not care, so that was great. So when I woke up, I was obviously pretty out of it, and I was on a lot of drugs and stuff, and then since then I've been on pain meds, but I'm really sensitive, so I actually, when I take my pain meds, I take a second medication, and that's to keep me from getting sick, because I definitely get sick when I take anything that's a strong medication. But it still makes me pretty out of it. I'll ask questions twice, that kind of thing. So it's been a week of me being pretty out of it, and also even with the pill, I'm not getting sick, I'm not throwing up, but I definitely still feel nauseous. So it's been a week, like even right now, like I'm just nauseous. So that's kind of a bummer, but it comes with the territory. So I actually have had a little bit of a complication. My left side, the drain was, which you guys got to see the tubes coming out of me, and then the, basically the sack of blood. That's a drain, and the drain coming out of me on my left side was bleeding quite a bit, and so the doctor was concerned. So basically, I am really not supposed to move my left side at all for quite some time, in case I do something and I pull or tear, something happens. I would be bleeding on the inside, and they would have to do a procedure to get that liquid out. and apparently that procedure is pretty painful. So actually I'm standing kind of crooked. I have been for a week. I just don't want anything to happen. I'm pretty nervous about that. But so there's that. So pain-wise, just in general, I mean, obviously the prescription painkillers really make a difference, but more just on a discomfort level, especially this left side, because I don't have feeling back everywhere yet. This left side freaks me out. I can't really feel under my armpit anymore, and so when my arm touches, I don't know, freaks me out. It's stiff and weird, but the pain is tolerable, like especially because it's something that is important to me, so it's worth it. I wouldn't say, you know, if I had to do it again, like, oh, it hurt, like, I'd still do it again. Like, it's worth it without a question. Emotionally, like, I'm just really excited. You know, like, the bruising will go away and the scars are so minimal because I just have scars basically right on the bottom half of my nipples, not even on the top half. Just kind of like a little smiley face down there. So my scars are going to go away really nice, and I can't believe it's finally here. Like, I did it. I watched a video recently, and this guy was saying, you know, I was pretty small before surgery, and then I would bind, so I thought, you know, once I have surgery, I'll look like this every day. But then once he had surgery, he was like, I can't believe how much flatter I was. I didn't realize I could be flatter. And of course I'm all like hunched over and I'm sore from surgery, but when I put his shirt on, I know exactly what he was talking about. Like, it's even flatter than I thought it was going to be. And I wasn't even going for that. I was just going for what I looked like when I had my binder on. So that was kind of a nice surprise. So recovery time, just to give people that might not know, you know, what it's like, at least for my surgery and my experience, it is supposed to take upwards of 2 months before I can really start lifting things, moving things, and then the first like 2 to 3 weeks is when you have to be pretty careful and, you know, don't do anything too extreme. I ended up taking a week and plus the weekend time, so a week and 2 days total off of work, and I'm going to go back on Monday. So, but my job currently, what they're having me do is pretty relaxed. It's just office work, you know, I'm not doing anything physical. I'm sitting at a desk working on a computer, stuff like that. And if you guys had any questions about price, how much surgery costs, I know it varies from doctor to doctor, so, you know, this won't be exact. But I went to a doctor in Thousand Oaks. Actually, it's Thousand Oaks, California, and it's two brothers, and they're great. They both do surgeries. I had one doctor. I'm sure the other one's just as good, but it's Kryger in Thousand Oaks. That's their last name, and it cost me basically $5,000, right around there. So that was just for the surgery. But they didn't tack on any added, like, and then, you know, there's the waiting room time. Like, I don't know what else they tack on, but they didn't. So that's what it cost me. So I know that varies, but I had questions about that when I was looking for surgeons. So hopefully that helps you guys out. I will update for my next month of hormones, and then I'll also do another update for 1 month on, or 1 month post-op, so you guys can see how I'm healing up, and hopefully things will be going good then. So thanks for watching, and I'll update again soon. Bye everyone.